All right, hey everybody, this is Carolyn, Carolyn, educator and a healthcare practitioner. So tonight, let me see if I can go to Facebook on my iPhone. Let me turn this down. It says I am live. Yay, yay! Come on in, everybody. Come on in. So tonight's topic, hopefully, if you come in, what I need you to do is I need you to say hi to me, and hopefully Facebook be nice and show me who you are so I can give you a thank you for tuning in with me. All right? So tonight's topic is going to be on understanding your levels, our levels of the healthcare system, the framework, and the structure. So it is where you are at in the healthcare system and what is your first line of entering into the healthcare system. I wonder if I can go live on Instagram. Let's see if I can go live on Instagram. Because I tried to upload a video to Instagram and it says my video was too long. So I'm going to try to go live on Instagram. Give me a minute. Is this the one I want to go on? No. Let me change the Instagram accounts. Okay, this is the one I want to go live on. All right. Home. Plus sign. Hey. Let me turn this up. I think I got it. Okay, it won't let me go live. They changed the algorithm. Algorithm has changed. So if I switch over to my other Instagram account, I know I could go live on that one. But that's not where I want to go live at. All right. All right, so hey everybody, I am Carolyn. Y'all all know who I am. And tonight's topic is going to be on understanding levels of healthcare so you know where you're at. And the reason why I'm doing this is because, hi Mark, good evening. Thank you for tuning in. So everybody should know when they go see the doctor or they go to the ER, what framework are they in the healthcare system. So what I did is I looked at my notes and I had to write it out. So what I'm going to do is I'm going to take you through the framework of how the healthcare system is set up, the structure of it. I'm going to give you providers in that framework as well as the services that go into that framework. What I want you to do is I want you to think about who you know, including yourself, and where you fit in to the framework and the structure of what I'm about to give you. All right? And then I'm going to give you some questions. Not that you have to answer me, but questions for you to answer for yourself. So the first level is you have primary, secondary, tertiary, and quaternary. Then you have preventive, and then you have long-term care. That's us. Preventive health care, and then you have long-term care. But you got 4 types of frameworks. So I'm going to go, if you have any questions, type them in so I can see them, okay? Facebook is being nice to me tonight. It's letting me see who's there, but of course, it's on my iPhone and not my freaking Android. Android don't let me see jack. I have to go to my iPhone to see it. So, the first one is your primary care. This is your base, your first line of being entered into the healthcare system. Just because you have medical card or a healthcare card because you have some type of health insurance, that's to get you in to have health care, to be treated, to get you in. You're not in until something happens to your human body. Okay? Which means you're going to go see your PCP. And it's not a drug, it means primary care physician. PCP, when you hear me say PCP, it means primary care physician. Now, primary care is where you're going to enter your first system. Here are your providers. One, your primary care physician, internal medicine physician, your nurse practitioner, your PAs, which is your physician assistants, your general pediatricians, baby doctors, and then you have community healthcare clinics, and they still have those around. What services do you get from these specific providers in this primary care framework? Remember what I said. When I go through these, I want you to think about where are you at and what level of the healthcare system, what structure, and what framework you're in. So here are your services. Don't, you know what? I keep looking at this, and don't mind this. I'm old-fashioned, and my hair is done, but every time I get my hair done like this, it looks like I got a big forehead. Moving on. Services that you'll receive in primary care. I want you to think about this. Most of us has been to the doctor at some point. Most of us has been to the hospital at some point. Most of us has been to the ER at some point. So I want you to think about these services. This is the first framework, primary care. Services, you go get annual physicals. If you're not getting your annual physical, why not? You should be going to get a yearly physical. If you're not, why not? It's very important that you do so. Hi, Mark. Preventive health screenings. You may not even know what they are, but I'm going to share this with you. For every age bracket, you know how when mothers know this, and some daddies who were engaged with their kids know this, when you take your baby to the doctor, you take your baby to the pediatrician, they have by age where your child should be. All right? It's no different. That goes from the time that child is born, and then when that child becomes an adolescence, there's a different framework. From adolescence to teenage, there's a different framework. So stop at age 20. When you get to age 20, by a 10-year growth, there's different tests that you should have done that has to do with your age bracket. So that would go anywhere from 20. People live today past 100. Bless them. Those are history buffs because they could tell you some stuff. So for each age bracket, there's specific tests that you should have done. Do people know that? Generally, no. They don't. They know the common ones. Oh, when you turn 50, you got to get a colonoscopy. Ladies, once you hit 30, 35, you got to start getting mammograms. But what about the other important tests? We'll get to that later. Next is vaccinations. Primary care, vaccinations. Basic lab tests like sugar tests, bone density tests, chronic disease management. A lot of people are suffering with chronic diseases, and they are learning how to manage their chronic health condition. Minor illnesses and injuries, primary care. These are still services in the primary care. And specialist referrals. Once I go through all four, I'm going to give you an example of what it looks like. I'm going to try to give you an example of what it looks like anyway. What is the goal of this primary framework? Number one is prevention, early detection, and routine management. That's the goal of primary care. Prevention, routine management, early detection. Where are you in primary care? The first framework. I told you who the providers were. I told you what the services are. I told you what the goal is. If you are not engaged in your health, especially in today's time, and you're not paying attention at all, you should be. You should be. I've been talking health topics for several years now. And if you go back and you look at those videos, you can pick up some information. I think they're still up if they haven't been removed by Meta, Facebook. Secondary structure. This is where you go see your specialist. You get specialist care. Your care is provided by medical specialists. Now, when we talk about the second part, the second structure, the second level of the framework, what specialists have you seen? How did you get there? And why did you go see a specialist? Then I'm going to share a story with you. Who are your providers? These are your specialists. Cardiologist is at the freaking top of my damn list. Neurologists, these are just a few. Dermatologists, orthopedists, endocrinologists, OBGYN, and urologists. I don't want to forget the men, urologists too. What services are you going to receive, and these are just some, what services are you going to receive in the secondary structure of this framework? You're going to receive specialist evaluations. They have to have you go through tests so they can get their data on you so that they know what's going on with you. Sure, they're going to get the documentation, the SOAP notes from your primary care physician if the primary care physician shares that information, or that specialist requests the information, or the specialist is going to send you to some specialized tests so he can have his own information of what's going on with you for the reason of why you are there to see him or her. All right? Advanced diagnostics. That's another test. Test here. And I also have advanced complex procedures. Those are for specific health conditions that people have. And then there is condition-specific tests, treatment plans. So you're going to go see the specialist. The specialist is requiring you to get specific tests. They're going to take a look at those test results. Based on those test results, they're going to discuss it with you. At least they should discuss it with you. And when they discuss those tests with you, you should be asking questions about those tests. I'm going to tell you a story. And I'm not going to drop no names. You should be asking. The goal for the secondary framework is to target diagnosis and treatment for specific conditions. Like I said, cardiologist was at the top of my list. What people go see a cardiologist for? Their heart. Why do women go see OBGYN? For top area, bottom area. Y'all know what I'm talking about. The reproductive area. Why do men go see a urologist? Okay? Then we have the tertiary. Tertiary is going to be targeted for advanced hospital-based care. Thank you for the thumbs up. For advanced hospital care. And this is where it gets specialized, and it can be complex. Hold on, y'all. My braids are tight. They're giving me a headache. In this third framework, it's going to be providers and what type of settings it's in. Hi, Steve. Thank you for tuning in. I appreciate you being here. And this tertiary framework is going to be major hospitals. So, when it comes to the third structure of the framework, I want you to think about you and who you know that fits into this third framework. Then when I get to the fourth one, I'm going to wrap it up and try to give you a visual of how all this tie in, because this is how the standard framework is in healthcare, and a lot of people don't know it. You just know you go to the doctor. Just know you go see a specialist. You just know you went to the ER. You just know you got a referral. You just know you on this prescription medication. Whatever. All right? Providers and settings. This is the third. Number 3. Structure of the framework. You have large medical centers, teaching hospitals, and trauma centers. What services are you going to receive at a teaching hospital, a large medical center, and a trauma center? You're going to receive major surgeries, ICU care, cancer treatment, complex cardiac care, neurosurgery, organ support systems, advanced imaging and intervention. What is the goal? Manage serious, complex health conditions, specialized hospitals, trauma center. It can be, at this level, a life-threatening health condition, and that's why that person is there. All right? Then we on our last one, but there is preventive care levels, just like there is 4 levels of the medical structure healthcare system. There's also 3 levels of preventive care levels. That's for public health. So let's go with the 4th. The 4th level is quaternary care, which is specialized care. If you have any questions, let me know so I can answer your questions for you. So at the 4th level, they're rare, they're cutting edge, and they're on a trial basis. Specialized services that's on, when I say trial basis, I'm talking about clinical trials. Have y'all ever heard of clinical trials? Have you ever been somewhere in a hospital and they got this sign up that says volunteers needed or volunteers wanted for a clinical trial? And if you decide that you want to be a person who volunteers for this clinical trial, you got some paperwork to sign. A lot of waivers is going to be signed if you signed up for that clinical trial. Why do they do clinical trials? They do the clinical trials because they need to know if their study is going to be effective in treating someone with that clinical trial. And a lot of times with these clinical trials, you can best believe there's some type of medication involved in there. And if something should go wrong, nobody can sue. All right? Your settings. You're going to be in this elite specialty setting, up-to-date, state-of-the-art setting. These are going to be your research hospitals, your academic medical institutions, research hospitals, elite settings, and academic medical institutions, because they all about research. They're all about clinical trials. They need to know if their hypothesis on what they are working on is going to work. And you, because you volunteered, you signed some paperwork, are the guinea pig. That's the best way I can explain it. Hate to put it that way, but it is what it is. Okay? Services that you may receive there. Organ transplants. That's at the top of my list. Organ transplants. Experimental treatments. Remember, I said clinical trials. Experimental treatments. What kind of freaking procedure is they working on? What kind of medication or concoction of a medication have they created that they want to try and see if it works? And what if it doesn't? So, I'm going to give you an example. Watch TV. Watch TV for at least an hour. See how many pharmaceutical medications come up in an hour on your TV. If you're in a hospital and they have that TV on. Thank you, Steve. Steve says I'm always dropping facts. Thank you. And you're in a hospital. Watch how many commercials come on for some freaking pharmaceuticals. And at the bottom of it, it gives you the small print. Side effects, including death. But here's the thing. With these clinical trials and these experimental treatments, you are signing your life and putting your life on trial in hopes that it works. This is how come they say, you know what, with these clinical trials, so many people have been tested. 500 people have been treated. It has been found to be effective in treating 500 people. However, if you have such and such condition, it's not for you. That's just the way the medical system is, everybody. If you never thought about it, think about it now. All right? Rare disease programs. Advanced robotic surgery. Complex reconstructive procedures. Now, we have babies from other third world countries who come over here in the United States, and they receive these complex reconstructive surgeries. And I must say, from what I saw, not that I witnessed personally, but I saw like the before and the after pictures, they're very successful. The pediatricians or the surgeons that did these surgeries are very successful with these reconstructive surgeries as far as pediatrics. Adults, I haven't seen, but I have seen the pediatrics. Gold treat rare or extraordinary complex cases using advanced technology. That's the goal of the quaternary framework for the U.S. healthcare framework, healthcare structure. Now, let's talk about the preventive care levels. This is public, and this is the public model. All right, so we went over the framework, the standard framework that's related to preventive and long-term care. We covered primary, secondary, tertiary, and quaternary. And in each one of those frameworks, I gave you the providers and the settings, or I gave you the provider and the services, or I gave you the providers and the settings and the services. Then in each one, I told you what the goal of that structure was. This is the first step in understanding on how to take control of your own health and not just be part of the healthcare system and go along with what they're saying and believe in everything they're saying, and you're not having 100% interest, and I mean 100% interest in your healthcare. If you're not asking questions, you're not doing 100%. If you're not asking the right freaking questions, you're not doing 100% of taking control of your own health. Just don't be a patient. Be an informed patient. Be an educated freaking patient. Be a patient who is in the know about their health. Moving on to preventive health care. Now, there is 3 levels of prevention. You have primary, secondary, and you have tertiary. Then you have long-term and supportive care. Let's talk about those. But before I do that, I'm going to tell you a story. Any story I tell you is true. Not something I made up. Some of the stuff you just can't make up. So I was having a conversation with a woman. And this woman, and I'm going to I probably do an information session on this type of machine, because I know several people that's on this type of machine, either because they have sleep apnea or they snore like disturbingly. All right. So this woman I was talking to, she's been on a CPAP machine for, I think she told me like 6-7 years. And I said, have you talked to your doctor about why you've been on this machine for so long? Have you asked your doctor any questions? Have you had a break off the CPAP machine? Have you been tested to see if you still need to be on the CPAP machine? And then I asked, are you on the CPAP machine permanently for the rest of your life? She says, yes. I said, why? And she says, get this, she says, because my doctor say so. So, your doctor say so, but did you ask questions? And she was like, no, I don't ask questions. I just know that I need to be on the CPAP machine because I have sleep apnea real bad. And if I'm not on the CPAP machine, I could die. That's what she told me. And keep this in mind. This was somebody that is very, very close to me. Very close. Like blood close. So, because this is a relative that's related to me by blood, I felt like I could say what I want to say and not have to worry about no disclaimers, not have to worry about no precautions. I said, listen, the next time you go to your doctor, ask your doctor these specific questions. And the questions I gave her was this. Ask your doctor, why are you on the CPAP machine and it's been 6 or 7 years that you've been on this machine? Ask your doctor, can you be retested to see if you still need to be on the CPAP machine? Because from what I understand, she has to be on the CPAP machine for 4 hours a day for the rest of her life. And I was like, ask your doctor those questions. So I gave her some more questions to ask the doctor. This person couldn't wait to call me. She says, I saw my doctor, and my doctor told me to tell you that I should listen to me and listen to her. I said, you know what? put me on the phone with your doctor. Let me ask your doctor the questions. Or the next time you take your ass to the doctor, I might be going with you so your doctor can tell me that to my face. I said, because here's the thing. You have patient rights. You have every right to ask your doctor the questions I told you to ask her. She can't get mad. She may not want to answer them, but she definitely should not be getting mad because you asked those questions and you went and told her, oh, my relative so-and-so told me to ask you these questions. If she don't want to answer them, there's a problem. If she don't want to answer those questions, maybe you should get another doctor. And I could say that to this person because they're a relative. But would I say this to somebody else? I would say it a different way. I would say, I suggest that you look for a second opinion. See? When you are in the healthcare industry and you're a licensed healthcare provider, you have to be very, very careful with the words that you use and who you're talking to. But because this was a relative, I just went all in. So, keep this in mind, people. You have patient rights. You have every right to ask your healthcare providers, including your PCPs, primary care physicians, everybody, questions. But know what questions to ask so you can get definitive answers. And see, here's the key. You got to know what questions to ask. You can ask general questions. They're going to give you general answers. You ask specific questions, lock them in. I do. And I won't let them off the hook because I need to know. I was my husband's biggest freaking advocate. I was always asking questions. I didn't give a damn that they didn't want to answer it. I'm asking anyway. And if I felt like they was talking too fast, I was like, yo, I asked you a question. You talk too fast. You need to slow it down. Because depending on what you say, I may ask you another question. And it needs to be to my level of understanding. And they will always try to talk over me, but I'm right there with them because I understand the language. And that's what patients need to do. Understand the language so that you can make informed decisions about your own freaking health care, even if it's in conjunction with your primary care provider or your healthcare provider. So it works hand in hand. It's not just one-sided. It's both-sided. You're an informed patient and they're the physician, and the two come together. And if you understand what your healthcare condition is and you understand the medication and you understand why you are taking it, you open yourself up to alternatives and not just one-sided. That's my point. So, I ain't mean to get off on the soapbox, but here we are. So, primary prevention. Prevent disease before it starts. Prevent disease before it starts. People don't believe in being vaccinated, and that's okay. There's other ways of protection if you don't believe in being vaccinated. Lifestyle. What type of lifestyle are y'all living? You live in the fast lane? You live in the sedentary lane? What kind of lane is you living in? What you doing with your life? How often are you consuming some alcoholic beverages? How often are you consuming some illegal drugs? How often are you smoking cigarettes? Lifestyle. Nutrition. How good is your nutritional regimen? How healthy is it? Do you know what's in your food? Do you know how it was manufactured? Are you reading the labels? Do you understand the fine print of the ingredients that's in there? Does it have red dye number 40? Does it have yellow dye number 5? Are you reading the labels? Most people's familiar with GMO, Okay. What else are you familiar with? MSG. What else are you familiar with? Know what you're putting nutritional wise into your body. It makes a hell of a difference. You had last night I did what? Wait a minute. Last night I talked about parasites. Know what's in your food. How contaminated is your food? Is it contaminated at all? Might not be. Pay attention to the callbacks. There's commercials. There's commercials that have food callbacks. Pay attention to those commercials because they recalling foods. Costco's. Walmart. Pay attention, everybody. If you're not sure about what food is being recalled, go to www.fda.gov. Food and Drug Administration. Go to the search bar. Anybody can do this. Go to the search bar and type in recall. Bing, 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 bing. A whole list of foods is going to come up. www.fda.gov. www.fda.gov. All right? Secondary prevention, everybody. Early detection. Early detection. How do you get the early detection? Lab tests. What part of the healthcare framework is lab tests in? I gave it to you, so you know where you at. Screenings, imaging, that's secondary. Tertiary prevention. Reduce complications. How do you reduce complications? Begin to know about your damn health. Know what's going on. People who are heavy, like according to the United States standards, are you within the right weight class according to your age? Are you in the obese category? Is it a precursor for diabetes? Is it a precursor for hypertension? Nutritional value. What are you eating that's causing you to have high blood pressure? Is high blood pressure preventable? It is. It definitely is. Rehab and disease management and post-event care. Rehab. Alcoholics. People with addictions. Sex addiction don't count. Sex addiction don't count. I mean, it's therapy for that, but we ain't talking about that. We're talking about alcoholic addiction, smoking addiction, types of addiction that's going to cause a person to have a metabolic disease. We're talking about those types of precursors and addictions that will cause a person to have a metabolic disease. All right? Long-term and supportive care levels. I'm about to wrap this up. Yep, I'm about to wrap it up. Independent living. Assisted living. Skilled nursing facilities. Who do you know, or who do you know of, that has placed a family member in any one of these facilities? Independent living, assisted living, long-term nursing facilities, rehabilitation centers. home health care. And if you have a loved one that you done placed in one of these, how often is you going to go see them? How often? You place your loved one into a home care facility, assisted living, long-term care facility. How often is you going to go see them? How often are you engaged in their health care while you put them in this facility? Are you asking to see the test results? Or you just leaving it up to the staff that work there to transport them back and forth to the doctor, or there's a doctor on staff that comes in there and see them? Are you asking any questions about them? Just saying. Hospice and palliative care. I know this all too well. Hospice and palliative care. End of life care. So, remember I said I was going to give you an example? So, it goes like this. You see your primary health care physician. You go see them. From there, your primary health care physician, and a lot of us have been in this position, I think, you get a referral to go see some kind of specialist. Depending on what's going on with you in your health care, in your body, you may be referred to have a procedure done at a hospital. You had a procedure done at the hospital, leave there, now you're going to an advanced care center. That's the system. That's the structure. So let me be more defined. A patient goes see a cardiologist. Patient is referred to the cardiologist from the PCP. PCP, primary care physician, says, okay, excuse me, I'm going to write you a referral to see a cardiologist. The cardiologist is the specialist. Now, based on the cardiologist's lab test or whatever it is that they're looking for, cardiologists may say, okay, you need to have some type of procedure done. So now you done saw your PCP who referred you to the cardiologist. Cardiologist found something on the test results. He wants to do, hold on. He wants to do a procedure. Now you're in the hospital. You go to the hospital and get the procedure done. Now you are referred to an advanced care center so that you can go through recovery. That's the example I have. But you know what? You could use another type of an example. You have men. I know this is a touchy subject, but it is what it is. You have a lot of men that is being diagnosed, they go see their PCP, they get diagnosed for prostate cancer. Prostate cancer is on a rise. I don't know if y'all paying attention or not, but it is. And then you need to check out the demographics of who, what culture, what demographics is being diagnosed with prostate cancer. They see their PCP, PCP refer them to go see the doctor, to get checked down there. Doctor says, okay, we're going to treat you, we're going to give you these medications in hopes of this, but you got to have this procedure done. Go to get the referral from the PCP, see the specialist, this person has to have a procedure done. They get the procedure done. Now they're in recovery. Starts with primary care. I took you from primary care to tertiary. I took you from primary care to tertiary care. I want you to think about who you know that's in that structure line. So these are some questions for thought. These are some questions These are general questions that I thought about that would benefit you. Do you have a primary care provider? Everybody don't. Some people don't even have health care. And people who don't have health care don't go to the doctor because they don't have the money to go to the doctor. So they don't go. And because they're not going to the doctor, there's things that is going on internally wrong with them, and they are sick. They have chronic illnesses because they don't have health care. And even though they should go to the ER anyway, some people don't. They don't. There's a population of people who don't have no health care. And they get neglected every freaking day. Every freaking day they get neglected. They get looked over. Have you ever been referred to a specialist? Who hasn't? They make money off of that. When you was referred to a specialist, did you understand why? Did you understand why? Have you or someone ever skipped the first layer, the intro layer, the primary, and you went straight to the freaking ER because you felt as though there was an emergency there? It's all in that structure. It's all in that framework. The framework is there. So I say this to you. Understanding the levels of healthcare gives us power. It gives us power to ask better questions. It gives us power to take control of our own health. It gives us power to be informed decision makers over our bodies in conjunction with the healthcare providers that have taken the HIPAA oath to do no harm. And they have. So it's very important that when you go to the doctor and they give you this freaking paper about, have you received a copy of the HIPAA oath, of the HIPAA? And you just freaking sign the damn thing, but you didn't read it. Read the paper, take it home. Read it. Read it till you have a level of understanding of what your rights are. And the goal is to, I have on here, seek the right care level to avoid unnecessary delays, costs, complications, and I'm going to put in there death. It's that serious. Health is very, very important. And that's physical health, mental health, most importantly, mental health, physical health, emotional health here, and spiritual health. All of those tie in to the big H, health. No matter how you look at it, they all tie in. So, that's my soapbox for the night. Thank you for tuning in. I'd like to give a big shout out. I am Caroline. Oh, okay, that's me. I'd like to give a big shout out to the gentleman that tuned into my live. I'd like to give a big shout out to Mr. Steve Savoy. Thank you for tuning in. I appreciate you for being here and giving me your ear. And I would like to give a big shout out to Mark 5 of Mark 5 Photography and Movie Productions. He's also a movie director. And also anybody who tunes in to this broadcast, Thank you for being here. I appreciate it. Share the broadcast. This broadcast can benefit somebody. I don't know who, but it can definitely help somebody, benefit somebody, and just know where you're at in the healthcare system. Always ask questions. Always ask questions. And depending on what your health condition is, when you ask a physician a question, if for any reason you are not satisfied with that physician's answer, then I want you to reach out to me so I can tell you where to go from there. Take care, everybody. Thank you for being here. And thank you for supporting. I will see y'all tomorrow night. Take care. Bye-bye.